Hi everyone, welcome back to Ask Dr. Rana. Today we are talking about a skin condition that's not just common but also commonly misunderstood, melasma. From wrong treatments to false hopes. Today I will help you understand what it really is, how it's different from regular pigmentation, and most importantly, why it becomes so difficult to treat when you reach the doctor too late. Melasma not equal to all pigmentation. Let's clear this up. Melasma is not the same as tanning, freckles, or post-inflammatory hyperpigmentation. Melasma is chronic, patchy, often symmetrical, found on the cheeks, forehead, and upper lip, triggered by sun, heat, hormones, and even visible light, and worsens with wrong treatments. Whereas PIH happens after acne or injury, tanning is due to sun and is reversible, and freckles are usually genetic. So now the big question, why is melasma so tough to treat? It's not because the condition is untreatable. It's because most patients unknowingly damage their skin before even they reach the right doctor. By the time they finally walk into a dermatologist clinic, they have already overused steroid creams, tried random peels, done unregulated lasers, overexfoliated their skin to the point of बैरियर डैमेज. और जब तक वो राइट ट्रीटमेंट तक पहुंचते हैं तब तक स्किन इतनी इरिटेटेड, इन्फ्लेम्ड और कॉम्प्रोमाइज्ड हो चुकी होती है कि फिर रिजल्ट्स लाना बहुत मुश्किल हो जाता है, इवन विद द बेस्ट ऑफ ट्रीटमेंट्स. सो दिस इज व्हाई आई ऑलवेज से melasma needs a soft, strategic and scientifically layered approach. No shortcuts. Another factor that most people ignore, lifestyle. Yes, your stress levels, sleep schedule, eating habits, all of them affect melasma. Stress increases cortisol, which worsens the pigmentation. Poor sleep affects skin healing. Inflammatory diet like sugar, processed food can aggravate the condition. आप सिर्फ क्रीम से melasma फिक्स नहीं कर सकते. It needs a holistic plan. स्किन को अंदर से काम करना पड़ता है, not just outside. Lasers are not the first step. One of the most common mistakes, people jumping into lasers too early. Lasers, especially the wrong ones, can worsen melasma. Why? Because melasma has vascular and dermal components. It reacts to heat, trauma, and inflammation. That's why we use low fluence lasers, pico lasers, or fractional approaches only after preparing the skin with the right topicals. Laser is not magic. It's a tool and timing is everything. So what does work? A layered personalized approach with topicals like kojic acid, azelaic acid, arbutin and trinismic acid. Oral medications, especially oral trinismic acid. Chemical peels done at the right strength and interval. Sun protection that blocks even visible light, not just UV. Lifestyle correction, stress management, better sleep, healthy skin friendly diet, and consistency. This is not a quick fix journey. Also, remember, every case of melasma is unique. What worked for someone else may not work for you. Melasma is not a punishment. It's a chronic condition, but it can be managed beautifully if you stop treating it blindly. So don't waste years and damage your skin further with DIYs or false promises. Find a qualified dermatologist who understands melasma and give your skin the expert it deserves. If you know someone who's struggling with pigmentation for years, do share this episode with them, because sometimes the right information at the right time can change everything. This is Ask Dr. Rana, real stories, real solutions.